I'm going to call the Springfield City Council work session to order with roll call.
Mayor Van Gordon,
Here.
Councilor Pitts,
Here.
Councilor Mo,
Here.
Councilor Rodley,
Here.
Councilor Stair,
Here.
Councilor Woodrow,
Here.
Councilor Pictionary.
I'm here. Thank you.
All right. We have two items tonight. The first one is the overnight parking program code change. And I don't know if Sandy or Christina is presenting. All right, come on up.
Parking program code change. This is a code change that is recommended by the city attorney's office. We're getting feedback. You okay? Okay. To address, to try to maintain some of the status quo around the current overnight parking program that is operating at Catholic Community Services during a recent zone change process that was intended to allow them to expand their operations under a city-sponsored grant. It was discovered, I guess we came to understand that they do not actually operate as a place of worship or a church from that location. And the overnight parking program is currently written to allow operation at churches and industrial locations. So this is a proposal to adjust that definition to include nonprofits that operate in somewhat of a similar capacity that churches do. We did get some feedback that locating these overnight parking programs at government or public sector locations may not be appropriate. So the original definition I was using came from the development code, social and religious institutions, which would also include things like community centers or other public sector properties. And so an attachment two, I showed those different types of social and religious institutions by different categories of uses, which would have included community centers, because community centers are also often co-located with other types of services that might be incompatible to the overnight parking program. I would recommend that we actually adjust the code slightly from what is in your packet to reflect private religious and social institutions so that it would be clear that it does not include government programs unless those government entities apply under the code language that already exists for the internal shelter program. And that was a code that was adopted by the council several years ago, a couple years ago. So it would leave open that existing option for governmental buildings to be used, but not for the governmental uses for the car camping program. So if there are any questions, I'm happy to answer them.
Marilee.
I didn't have a question. I read through it and I like the way it's written. I like how, what it's trying to do, what's it attempting to do, offer an opportunity for more community partners to be able to offer that service. So I'm okay with how you've got it. And I like the clarification of the definition that you just gave.
Leonard.
So, could you describe the neighborhood that this new site is in? I mean, is it residential or where is the site that's in question?
Yeah. So this was brought forward because of the existing site that's at Catholic Community Services, which is on G Street in Springfield, near, well, it's a G Street and 11th, I believe. The address is, 1025 G Street. So it's right between 10th and 11th. So they've been operating there under the church provision, but they're not operating as a place of worship. They're operating as a nonprofit entity at that location. So
10th and G, did that used to be a school?
across the street.
from
Across from it?
Yeah.
Okay, all right. I'm just trying to visualize where it is. Yeah, I checked the phrasing on this new code change and it looked good to me.
Okay.
Thank you.
Corey.
So I just want to clarify the sort of public versus private. Would that still include like just nonprofits, like social service nonprofits?
It would include social service nonprofits that fall within the definition we're proposing, which would be property being used as a place of worship for providing charitable services to the public, as a fraternal or civic organization, and then we would remove as a community or senior center, since those are public uses. So it would include places of worship, charitable services to the public, and fraternal and civic organizations. So it was intended to be those types of nonprofit uses that are public facing in a similar manner as a church or place of worship. It also gets the staff out of the position of questioning religious beliefs and determining if someone's eligible.
Right. And then my second piece of that, and I read it in here and I just wanted to like hear the clarification, because some of those sort of private social service nonprofits don't necessarily, they might be on leased land. So they would still need to have like whoever the property owner, it looked like, would be the one who would have to permit it, or is it that still as leased land, if they're operating a social service or public non-private, whatever we're calling it, would still be able to do it? Does that make sense?
It would require permission of the property owner as written. We're not proposing to change that
That part.
aspect.
Okay, thank you.
Marilee.
I had one clarification, and that is that even with the changes, it still falls under the requirement that it's 3,000 square feet to an acre, right? Is that, I mean, the size where anything would be offered still falls under that requirement. Is that correct?
That is correct. All of the same program standards would apply.
Okay, thank you.
Joe.
Thank you. So I'm getting mixed signals. As some people are looking at this as an expansion of the program, and others are just a definition of the current program. In my understanding, in looking at the materials presented, it's not necessarily an expansion, it just clarifying the definition. Is that correct?
It is a small expansion is how I would characterize it. Currently, churches are eligible. There are about 40 or so locations in Springfield that would fall under the definition of a church. I don't know whether those all meet the size requirements. Obviously, they're not all willing or wanting or able to participate. This would add less than 10 potentially eligible sites based on what staff could identify. Now, there might be other locations we didn't identify that might fall under this definition.
So that's based on the diagram then, amendment number 2?
Attachment number 2 was just staff's identification of the example types of facilities that we could think of that would fall under, that would be part of the, I guess, expansion, the minor expansion of the program. We did not contact any of these entities or organizations and ask about their willingness to participate. I assume willingness to participate in the program will still largely be contingent on the council's decisions around providing funding for the program, which is entirely separate. So, and we're not proposing right now any changes to the way that council administers the program. So very small change in eligibility in terms of numbers intended to help you maintain the status quo.
Okay, so what I'm looking at too is that I'm a little at a quandary, kind of not, I don't know if upset is the right word and whatnot, but you've added that some staff have added some areas that are in their minds potential, but some of those areas they cannot legally do it by their own policies. And so it kind of puts them in a spot where it's like others are looking at them saying, hey, how about we can contact them and see about putting some a tent housing area for people that are homeless, when those folks cannot by their own rules or policy even entertain that. So I just don't want people to look at this list and say, hey, let's contact these places and see if they'll do it, when really it's putting them between a rock and a hard place. I'm talking semi-cryptic because I don't want to put anybody on the spot. So I guess what I'm saying is that these lists should, before they're put out in the public, should be proofed to see if these organizations can even do it. So just take that for what it's worth. So there's a couple of areas that they can't even do it. But I do want to go back to the document that you provided in the packet, and it said minimum requirements must be met to participate, comma, I'm in the actually in the AIS under discussion financial impact, second paragraph about the second to the last line in that second paragraph where it says minimum requirements must be met to participate, including neighborhood compatibility. And I don't know if I've ever seen a definition of what neighborhood compatibility is and who makes that determination and what kind of process, decision-making process. So it is an objective look as opposed to a single person's subjective look. Just want to make sure that we have some sort of process, or there's a rules on which an employee that if they just got hired tomorrow can follow. Just throwing that out there. I think it'd be wise for us to have a objective process in which they determine the determination of neighborhood compatibility. That seems very subjective. And then moving on the document, I also see that under 8.014, I'm sorry, 12, paragraph 3, under attachment 1, page 3 of 3, where it states, talk about a property owner who permits overnight shelter pursuant to subsection 1 may revoke the permission at any time and for any reason. Upon revocation of permission or for overnight shelter, the permittee shall leave the property intermittently. Will they not fall under the rules of the FED process? And no one can force them out immediately until that FED process has been expired or has been exhausted.
I can start back answering questions, moving backwards if that works.
Sure.
The way this is written, it does not fall under the FED program because they are not being leased space, and the program agreements that individuals sign make that clear. So we're not concerned about an FED eviction process for either the overnight parking program or for the indoor program that's under the same code. Regarding who makes the decision around whether something would be incompatible with a neighborhood or constitute a public nuisance, that by code is the city manager or the city manager's designee. So it's up to the city manager to make that determination or to decide who the appropriate person to make that designation would be. And then on your first point, it's certainly my apologies if any of the property owners depicted on this map thought it was representing that they should be lobbied as a future site. Tried to make it really clear in the discussion at the top of the attachment that these were not potential sites or the types of eligible uses. And so trying to give the council an example of what you're being asked to approve, acknowledging that it's difficult to do that without concrete examples. But my apologies if that gave the wrong impression in the package.
No, and I totally read that. I read that summary at the top and that kind of a disclaimer, and I totally see where you're going with, but I'm just looking at it from some other property owner's perspective, hearing about this and being named in these documents and potentially a situs for this type of program can actually cause consternation amongst that organization where they've been trying to deal with that on their own. So I just want to let those folks know that we're sensitive to that, and that's not what we're doing. And then lastly on number 6 on 8.012 subparagraph or paragraph 6, where you are indicated private security services, I see how you scratched 181.870 subsection 6. That's the definition of what a private security person is. And I would be inclined to leave that in there so that way people can refer to that directly to see if, hey, is this person actually meet the definition of a private security provider? So that I would look at that and think about keeping that in there. And then you may even cite OAR 259-060-300. And that's the organ administrative rules that define all these services and definitions of who has to be licensed to be able to do that.
Counselor, 181.870 was renumbered to 181A.840. And so that is the statutory reference I've included in there. So
it's 840. Okay.
I'm keeping the statutory references and just updating from night watch person to private security services as used by the statute. So it was my intent to keep those definitions as used in the statute.
So was it remunerated to, was the 870, was it not remunerated to the 840 subsection 6?
It was renumbered to 181A, 840, 7 and 8, and I will double check that I don't have a typo there. I'll just make a note to triple check that statute. But the
Yeah.
181 was generally changed over to 181A a couple years ago.
That was the old one, yeah. And I don't know if you want to use the OAR, but it's pretty explanatory. So if anybody wants any information whatsoever about that whole topic, that they can dive into that OAR, and it's pages upon page of definitions. So other than that, appreciate that. Appreciate it. I think it's well constructed, and I support the change on this code.
Yeah, and I think that's a good call out about attachment 2, right? Is just simply being an example to get us to understand what we're actually approving versus a list of people that are interested in participating in this project. And the reason I want to call that out is just to make sure that everybody's clear that that's simply a attachment related to trying to show us physical examples. Leonard, did you have something else?
Yeah, just very briefly, I can understand that there would be, when I read neighborhood compatibility, obviously there are going to be some instances where an overnight parking program is clearly not compatible, but there are going to be other instances where you just sort of wait for neighborhood response. And then you see if there's any way to mollify the people who have concerns. I mean, is that accurate?
That's accurate. And your current code that we're not proposing to change reflects that need to sometimes do that, either make changes in the way it's run, or if changes can't be made to terminate a program at a location if it can't be in compliance on an ongoing basis.
Good deal. Thanks.
And just, I guess, to follow up on that question, right? And that's the way the code has always been written and really delegates that authority to the city manager.
Correct.
Yeah. Okay. I'm looking around to see if anybody's got other questions. All right. I think we're ready to take it back to a public hearing when it's time.
This will come to you next week. Thank you.
Thank you. All right. Second item is the annual use of force report with Chief Shear.
Good evening, everybody. And just I want to confirm with AJ that Lily and Sergeant Massey are going to be able to be on here as well. Perfect. Thanks for the opportunity to present tonight. Before we begin, I want to introduce Sergeant Massey, who leads our professional standards division. PSD plays a critical role in the collection and the review of our yearly use of force data and the creation of this annual force report. So Sergeant Massey also plays a significant role in our accountability efforts within SPD, and he is an integral part of our leadership team. He got assigned this role last year, shortly prior to my arrival at SPD, and he has, throughout this entire time, continually demonstrated his commitment to improving our force reporting and accountability processes. He's also been instrumental in driving the acquisition and implementation this year of the IA Pro software that I've talked to you all about in the past. I also want to introduce Lily Wick, who's here. She is our community outreach coordinator, but she's been assigned to professional standards for the last couple of weeks to help with the creation of this report and the analysis of our data. From her previous career, she has experience in data analysis, so we're extremely fortunate to have her step in this year to assist us until we're able to fill our upcoming crime analyst and use of force analyst position, which should be posted very soon. In April of 2020, SPD presented its first use of force report to this council. And that report stemmed from a settlement agreement between the city of Springfield and the estate of Stacy Kenny after a shooting death involving the Springfield Police Department. A culture of transparency in how SPD polices this community is a key component to building trust and legitimacy. And the use of force by police is a topic that demands a high level of transparency and a demonstrated effort to engage in ongoing improvements. A yearly reporting on force to include the amount of force used, the types of force used, the types and severity of injuries to everybody involved, the demographics of those involved, and transparency about lessons learned set us up as a community to experience an enhanced sense of legitimacy in the work that SPD engages in. And of the 6 pillars of 21st century policing, this force data and the efforts that we engage in to reduce the need to use force and to reduce injuries touch on all 6 of those pillars. And those include building trust with community, policy and oversight, leveraging use of technology, community policing and crime reduction, training and education, and officer wellness and safety. So there's a lot in this report. Hopefully you've all had a chance to look it over before tonight. There's a lot to cover, so I'm going to turn it over to Sergeant Massey. And in order to have sufficient time to answer questions, and of course, if it's okay with you, Mayor, I would ask that we hold questions till the end, so we have plenty of time to engage in that discussion once we get through the entire summary. So if that's okay with you, Mayor, we'll go ahead and turn it over to Sergeant Massey at this point.
Perfect. Thank you.
Thank you, Chief. Can you guys hear me okay?
Yes, we can.
Like the chief said, last year was our very first year of doing this. We had a pretty big year in 2001. A couple things we're pretty excited for. One is the software everybody's been hearing about called IA Pro. We also implemented body cameras in 2001 as well. The chief and I are 100% agreement with total transparency and owning up to any shortcomings that we can learn and improve from. Throughout this report, we have been doing that and making notes to find ways to improve for next year and to dive deeper into this report and the capabilities the software has. It's a very good, complex software. I'm confident in it. I back it up. Lots of agencies use it, and it's definitely something that's going to benefit us in years ahead. I'm going to, you guys have all the report in front of you. I'm going to break it up into different sections. I'm going to introduce what the IA Pro is. It's actually a two-piece software. The IA Pro software is what lives in my office. Out in the field, what line staff use is what's called Blue Team. I'll get more into that in a slide or two. And then we're going to talk about how it's entered by the line staff and how it's reviewed by management, and then followed by the data and the numbers and recommendations with conclusions. We went live in November of 2021 on this software. We had hoped to get live quite a bit earlier, but due to COVID and the vendor coming out, that was the soonest they could come and train us. As an organization, we worked really well together and really worked hard to backfill the data into the system because we wanted to use this system because we talked about it, we wanted it, we got it. We backfilled everything into it that we could in efforts to compile this report for you today. I'm going to try to define some definitions for you on the front end, also known as police lingo, or some things we might know but other people don't know. A couple different sections, major definitions is going to be use of force and show of force. Use of force, this could mean a compelling compliance or overcoming a resistance to an officer's command in order to protect life or property, to take a person into custody. That's when an officer, and in this report, it categorizes it as a use of force. A show of force is a show of force directed at a specific person to gain compliance. An example of that would be an officer displays a taser and tells the person they have their taser out. If they don't comply, they may get tased, and then the person complies and gets placed in custody without any further incident. That would be a show of force. A police dog barking, them saying we're going to send the dog if you don't stop running. He stops running, or she, and that's a show of force with the dog. We collect that data because we think it's important instead of just the uses as well. So you'll see in here different categories of show and use. Next slide, Lily. So before the IA Pro and Blue Team software came, just a little back history and how we used to do it. An officer would have a use of force incident. They would type their report, print photographs with it, and then turn it into the shift supervisor. And that shift supervisor would review it, check it for accuracy, and send it through to my office. And since we've now gone to the Blue Team, we've expanded the review approval process. We've added another layer and the Blue Team. So in the top left corner, that's the Blue Team icon. That's where the officer will click on that out in the field, and they can fill this out while still out on shift on the road. And then they will go through and start doing their check boxes of things. They're going to go into what kind of incident was it, what kind of force was used, any injuries to them, everything we would ever want to know There's a silhouette diagram there that you can even put on there exactly where it occurred at, on them and on the officer. Once they get that all together, then they send it to the supervisor who was on shift at the time of the incident. So there's a familiarity with them. They were on shift with them when it happened, and then they can take it and start triaging and looking through it as well. Once the sergeant gets it, they're gonna get the blue team, look at all the data that this officer's entered. They're gonna get the police report. They're also gonna get any body camera footage and basically make a package deal and then review it all for completeness, accuracy, making sure everything's within policy, making sure the video lines up with what the narrative and the report says. And once they feel that it has passed all that, then they send it up to their lieutenant, which would be the patrol commander. That patrol commander now is the new level that we've added. And they are going to do the same thing. Read the report, watch the videos. Everything gets looked at and it's traced and it's timestamped on who was in it, who was doing what. And then from there, it goes into my office electronically into the IA Pro data where it gets converted, and I just do minor cleanups of something, whether something was missed, they input the case number wrong with a hyphen or not with a hyphen, or simple things like that. They could also, during this process, submit something directly to me or the chief of police if there's any misconduct or any other allegations as well. But the system it's very complex. It's good. We're still learning it. We're going to learn more about it. We've just barely dabbled into the capabilities of it. I know there's even more we can do with it. So we've already made some suggestions, and I'm sure you'll have some as well. And I'm eager to hear what those are so we can adapt and pivot and accommodate those down the road. The next slide, Lily, please. This is going to be how the system counts use of force incidences, basically. On the left-hand side is the event. That's what occurred. And then you'll see this is a situation where 2 police officers could have 8 uses of force. So this could maybe be like a street fight or something where there's three people involved. And over there on the category, those could be categories of what occurred or what force was used. And then on the right, that's going to total up to 8. Yeah. And so how we do it is we're totally transparent. We wanted to say 8. You could probably count this as 3 because it's 3 people. We are counting each use of force, not each person. So we want it to be fully out exactly what we're doing, what was used. But it definitely shows how things can add up, and it will document if the officer used one thing and then worked to the next thing, and it shows, the common of what's being used the most by officers. There's a whole array of different categories, which I'll get into a little more. We'll stay on that slide for now. On page 5 of a use of force report, that's going to be the demographics. There's a pie chart, and it also flows on to page 6 regarding age-related subjects. Page 9 is kind of where the data starts. This is where officers involved, where a deadly weapon was introduced into their situation. So in 2021, we had 190 events. 14 of those involved people who were confirmed to be armed with a deadly or dangerous weapon. That's going to be defined as an instrument or an article or substance specifically designed for potential capable of causing death or serious injury. So 14 of those, somebody was armed with that, and 19 of them, the officer perceived that they had that. And the perception of that would be, it might not be visible to the officer, but the officer believes there was a weapon based on the subject's behavior, totality of the circumstances, including any information officers may have had before the event, reaching for a bag, witness information, or something reported on scene. Another kind of hard time a lot of agencies have had is training. In 2021, we were able to complete the Department of Public Safety and Standard training requirements. They require police officers to have a minimum of 8 hours of use of force training in a year. They also offered an extension to agencies who were not able to complete that due to COVID, training restrictions, capacity issues, not being able to send people to trainings that got canceled. As Springfield Police, we opted to not apply for that and still move forward with training because we believe it's very important and not to let tactics and skills go static. Out of the 8 required, Springfield Police was able to complete 23 hours of use of force training in various subjects. It's extremely important that we don't stop the training. We got very creative how we could do it. We ended up using online services, doing them during roll call. They were able to complete those while on shift and out on the road. So we just wanted to really keep that going. And it actually was pretty successful. 23 hours out of the required 8 is actually pretty good for a year. Some more numbers. Effectiveness of some tools is what it's titled here, tools of force. Within the data, we discovered that a taser, a discharge of a taser, that means the taser was applied, the trigger was pulled, and an activation occurred. Out of that, that was the least effective tool out of the tasers. However, I don't want to discount that still is a very important and very good tool to use. It was still effective 77, almost 78% of the time it was applied, it was effective. And the reasons why I wanted to point this out is because a lot of people in the public don't know why a taser wouldn't work. And in these cases, we looked into that to see why didn't they work? Why is it listed as the most ineffective one that we have? And things we found out was the person that it was used on, they had really heavy clothing on, and the darts from it were not able to stick. On one case, the subject was running away. That's kind of hard to get sometimes too. Another one was a level of intoxication was of such that had no effect on the person. And another one was heavy clothing. During wintertime, that's kind of a common thing. So you'll see that in the report, but I don't want anybody to think that a taser is not an effective or a good tool to use. It's very good. And learning from this, we're going to make notations of this for training to kind of go forward because we would like everything to be effective that we use. The second least effective, and I'll get to this one a little more later, is the leg and hand strikes. That was at 79% effective. Lily, next slide, please. This is when we start getting into the weeds with the numbers here. The Springfield Police Department, their phone rang 50,000 times essentially. And they were dispatched officers 2 calls. Those calls for service up on the top could be CSO, cahoots, anything. Officers dispatched to calls regarding the same category, 28,779. It's quite a bit. Out of those 28,000 calls for service, force was used 190 different times by the Springfield Police Department. A show of force was 93 times. There's going to be a difference there, as I explained earlier. The Springfield Police Department arrested 3,500 people, 3,483 individuals got arrested. Resulted in a show of force, 2.76% of those people, and a use of force was 5.46. So if you do the math on that, that's a lot of people contacted with some sort of force, and there will be some categories down the road that you'll see what falls into those categories. I'm hoping some of the questions will be answered as we go along fluid on this. Next is going to be the police officer holds, and that is usually involves someone who's having a mental health crisis. That is when an officer deems that they are in danger to themselves or others, and they take them on what's called a police officer hold, where they are then transported to a medical facility for an evaluation. So the number at the bottom you'll see that we used force on almost 13.5% on those. That looks high on the front end, but 122 of those, no force was used. They were able to do that. So I'm going to dabble on that a little later in the report as well. So we talk a lot about when force was used, when it was used, et cetera, but I like to also point out when it was not used. Those numbers usually aren't highlighted very much, I don't think. Force was not used in almost 3,300 of the arrests. That's 94.5% of our arrests did not have any use of force involved. I think that's a good number for the size. Everything we do always can, you can look at it and see what we can learn from, but almost 95% of everybody that gets arrested, we don't use force on them at all. Lily, next slide, please. We're going on to the injuries. Okay. So this is involving injuries on the police officers. All police officers that got injured. There's categories of minor injury, complaint of pain, and then abrasion and laceration. On the front end, some of these seem like the same thing. And we're probably right. And that's part of the learning process of the software, is how we can dissect that, and can we customize it to kind of put these in the one category. At the bottom number, you see that 16 injuries were reported. So that's not going to be 16 officers. There was actually 9 officers that were injured. 16 is just how many injuries were totaled up. One officer could have 2 of these sections. They could have cut something open and had a minor injury, or complained of pain. So we're going to look into that to see what is that telling us, and how can we collect that differently possibly. Next slide, Lily, to the subject injuries. So these are people who are under the arrest section, who got arrested and had some kind of injury. The left-hand side again is the injury. On the right is what occurred during that incident that caused that. The bottom number is 63. And total people was 44. So out of 28,779 calls for service, 44 people were injured. One of the main contributors to that is going to fall under the hand and leg strike. That usually is the number one, and I'll talk a little more about it, but that's where it's going to fall into. 25% of the arrests we do result in an injury to either the officer or the subject. 74 to 75% of them do not. The city of Springfield, we also have our own municipal jail. And last year in 2021, our jail accepted 1,380 inmates. Now, those inmates range from people brought in from the Springfield Police Department, the U.S. Marshals, Eugene Police, Junction City Police, and Coburg Police. And out of 1,380 inmates that were booked, there was some use of force on 50 of them. Something that the data doesn't show unless we start reading each individual report that is a question is, what is that a result of them coming off the road hostile? Is that just a continuation of their behavior from when they came in on the police car, or is that something that happened just in the jail? Control hold is the number one method used in the jail. And like before, I talked about how 2 police officers and 3 people could be 8 uses of forces. The jail is actually a lot higher. Because if somebody in the jail needs to get their clothes off and be strip searched, for instance, there's going to be probably 4 jailers, 1 on each arm, 1 on each leg. So you got 4 employees now. Each one of those employees is doing what you're going to call a control hold, probably an escort hold on the way there, and they're going to strip them and put them in there. So, I mean, you could just off that one person have almost 10 incidences. Hang on, my lights just went off. So the jail kind of has a unique way, and we're going to try to learn how to kind of go from that. But 157 applications of some force were used at the Springfield Municipal Jail, and that's 4% of the total people booked in to the Springfield Jail, and that's including people that came from other areas that weren't, Springfield citizens or something else from another agency as well. Next slide, Lily, please. So this is kind of, while going through this and dissecting some of the data, we kind of learned some things, or kind of raised an eyebrow at some things to maybe look deeper into. Doesn't mean something was wrong, but it might be something we want to look further into. One of them earlier I mentioned was the police officer holds. That was 13% of those had some fashion of some use of force. The question is, why is that? So we started kind of looking into and seeing, well, some things just happen, but also as an organization, we haven't had crisis intervention training for several years now. Things have changed possibly, and that's something we're going to look at too. So one of the recommendations we have is to schedule some crisis intervention training in the early of this year, as much as COVID allows us to do it. We used to do a pretty big one, and we really, as an organization, don't want to use COVID as an excuse. We still need to keep moving forward and be successful and keep trying to strive and be better at everything we do. So we're trying to be creative to figure out a way to do that, but that's definitely one of the recommendations we have. The second recommendation is going through this report and how we have this new approval process. We make the officers input their data into the blue team software, which I get later on the back end of it. It's not in our policy. And so one of that is we're going to put it in our policy that they shall complete the blue team entries, and the process of which it gets reviewed and or diverted for misconduct to me will be laid out in there as well. But we definitely need to have very clear, exactly this is what we need to do. This is how it needs to be done, and put it in there very clear for all of staff and management to know how to process these. Number 3, this is going to go back to the hand and leg strikes. We're going to take a closer look at this. To be honest, it's probably a historical high number for hand strikes to cause injuries. According to our system and the data that we put in, 38% of all of our officers' injuries were a result of a leg or a hand strike, which was only effective 79% of the time. Those in management or know, if you break your hand, they don't recover in 2 days. It's very costly to the city, and there's a lot of downtime. So if we can prevent that, that'd be great. That same use of force also contributed to 30% of the subjects that were arrested to their injuries. So what we're going to take a look at that data, we're going to further analyze it and discuss with our control tactics team, our command staff, our training staff. We're going to try to find possible alternatives to reduce injuries and increase effective arrest going forward. Number 4 was, it involves pepper spray. We looked at this and said no one used pepper spray. It doesn't mean they couldn't or they shouldn't, but it was why. And pepper spray is known to be kind of an aerosol cloud sometimes when you use it, and people might be scared to use it. You spray it indoors. A good example someone said is at a movie theater, a security guard, I believe, sprayed it in the movie theater, and the whole theater had to get evacuated because it affected everybody. Pepper spray actually is very effective. I've been pepper sprayed. It hurts, it works. It's not life-threatening, and it is a very good tool. Something one of our control tactics team instructors brought to our attention is there's a gel version. I never knew this. So we told them, please explore that. And they came and did a demo, and this is a gel. It's not a mist. It's more of a direct fire out the can and right onto a person with little to zero effect, hopefully on anybody else around, unless there might be some splatter coming off of someone or something, or ricochet off of an object. The second part of why this gel option might be good is there's an aftercare product that comes with it. Normal pepper spray, when you get sprayed, it's basically sit and wait, and you gotta wait and you gotta wait until it's done cooking on your skin. This has some kind of topical cream or something, and you apply it to the person it was applied on, and it drastically reduces the effects, and it pretty much stops it, which is pretty wild because everybody that's been pepper sprayed wants it to stop. So we're going to look more into that, which I think is going to be a good option as well. Recommendation number 5 kind of falls on to the employees. We want our employees to be healthy, we want them to be happy, physically, mentally. We have a peer support team here that really is great for the individuals to fall back on. We strive to push and organize a physical fitness program, anything we can do to try to build a well-being so that they can provide a good service and provide a quality product and come to work excited, knowing they have people here to back them up, knowing if they have a problem, they can talk to somebody. And hopefully that can just help the overall product that they can produce for our community. Recommendation number 6, May of 2021, a use of force incident was triggered by the Springfield Police Department. The Forest Review Board found some recommendations, which I noted in this report. And some of those recommendations are to reinforce additional options. For instance, using a trained negotiator on a scene when the situation becomes static. Start using more options and more resources that we have available. Don't be shy to ask for more help or to say, hey, what we're doing is not working. What should we do? Emphasize more on de-escalation training and update for the CIT refresher classes. That was involving recommendation number 1. Also, we recommended that dispatchers be included in the department de-escalation training. I think that's very well to include them here at Springfield. Our dispatch is in-house. They're not off-site or a service. We know each other. I think it's very important that we all are on the same page as a team and kind of have the same training. I think that's very, very important. Policy recommendations. In that it says if a supervisor on shift is involved in like a use of force incident, that they're going to be on the board. The chief, I think that's very, very awkward because they're actually subject to being reviewed themselves as part of the Forest Review Board. Part of that is was the supervision done right, and to go through that. So we think we need to remove the supervisor from being on the board and implement another supervisor. So the conclusion, and I'm sure a lot of the questions is, how does this compare to last year? Because I wanted to know that the whole time doing this thing too. From what I can tell, we're down a little bit, but we can't compare it the same because we did not have IA Pro. We basically used Excel in 2020, to be honest. So from this year, this is going to be our baseline foundation, and we're going to tweak some things and customize some areas that we think will reduce the fogginess of some of the data or categories. And we're going to move forward from there and try to create a baseline to just always go off of every year. I'm still confident that this is a really good system. I think it's really good for our officers. It's going to have accountability and total transparency. And we can ask questions and pull data from this thing super fast and learn trends or what's happening and what's not that we never ever had before. This is a totally new thing for us. And I'm super excited that we have it. And I look forward to seeing really what its full potential is. Because to be honest, we're still driving this new software on training wheels. It is a very big, good system. And I know it has lots of capability that we haven't tapped into yet. So I'm ready for questions. If anybody has any that I didn't answer within there or that weren't defined in the bottom of the report.
All right, we're going to start through the questions, and pretty much everybody's got questions now. So we're going to give them to you rapid fire style. Joe.
Do it.
Oh, thank you. Hey, Mike, if you can go back on your page, page 9 of 18, you indicate the effectiveness and methods for methods and tools of force. You indicate it towards the bottom where it says 40 millimeter non-lethal. I'm really concerned about the terminology on that. Are you using, what rounds are you using at 40 millimeter? Do you have exact, direct, wood baton, bean bag, or rubber ball rounds? Which ones do EPD or Springfield PD carries?
For the 40 millimeter?
Yeah.
It's those like blue tip sponge round things, I believe.
Okay, so those are, I think those are called direct impact or exact impact, probably direct impact. So on those, they even say on that round case not to be deployed less than 33 feet away from the subject. So it's, or potential serious or death could result.
Mm-hmm.
So I'm looking at say maybe just a simple twist of that term so we don't find ourselves in a corner by just simply writing, going right back to the 40 millimeter less than lethal. Okay. As opposed to non-lethal, because I think they actually can be lethal. It depends upon the contact area when those are deployed and the distance from deployment.
Okay. Yeah, I had a hard time trying to find proper verbiage for a lot, so I appreciate that feedback. I'll talk to the control tactics people about exactly what they're called.
Yeah, and plus that doesn't limit you for what kind of rounds in the future you may want to purchase for the 40 millimeter. You could go to rubber balls or wood baton, and those are definitely not non-lethal rounds. So
okay,
just didn't want to see you box yourself in a corner.
Thank you.
And then on the when you're going back to your recommendations 3 and 4, I think are really tied together when you were talking about leg and hand strike, and I'm really glad you expanded on the pepper spray options. I know that one thing I want to caution you folks is that you'll find that the gel OC that's deployed, that same material can be gathered up on that person's face and thrown back on the officers.
Oh.
So you want to maybe look at a pepper spray that comes out as a foam and then effervescence to a liquid on that person's face, so it's less likely to be gathered up.
Okay.
And so you have, and again, those leg hand strikes, the data that you have, you really brought up a good part of that is that I think you really need to look at, a lot of old school training, a lot of old school training officers go right to hands-on. And I think you need to look at, okay, from what distance were they initiating that contact by moving in on that subject to, for example, the cell extraction or removal of a vehicle? Do they, in other words, they weren't immediately had to go to a hands-on leg takedown or leg kick because of the proximity and they're right on top of them versus moving in on somebody and using that tactic. So I think those are two different things. And if they're moving in on a person, I think there's a much higher need for going to an force option such as OC first. And there is many different varieties of OC out there for sure, stream, fog, mist, whatever. But that's something I would like to see. That did they move in on a person and use a hand strike or leg strike, or did they have to because of a immediate defensive reaction? So I think that plays a big role. And then also, as far as material to clean up, dish soap that cuts oil is perfect for pepper spray, by the way.
Okay.
And I think those are really the only two things. I think the report was very complete, and I really appreciate your thoroughness on this. And it clears up a lot of things in my mind, and hopefully clears up a lot of things in the citizens' minds.
Thank you. Appreciate that.
You bet.
All right. So before we continue, could we maybe drop the slides so we can get a better view of everybody? Thank you. I'm going to go with Leonard.
Thanks. Good news first, no fatalities. That's a most welcome development, and happy to see it. I was also happy to see that the hand leg strikes were only 9.1% of the uses of force. But as you did say, the hand leg strikes also caused 32% of the injuries. Do you have any kind of statistics on how many times de-escalation was attempted before the hand leg strikes were used? This is sort of I guess, a sideways approach to Councilor Pishnary's question.
Yeah, I don't on this because a lot of this was backdated and the policy before. Some of it might not have had it, but de-escalation is part of our use of force now. So usually by the time it gets to that now, that should have been attempted. And
Do you know that it was?
no, I didn't pull each of these up. I'm going off of the backdated data.
Okay. And the other question I did want to ask is at what point in the continuum are hand leg strikes used? First of all, a leg strike, is that a kick? Is that pretty much what that is? I mean,
that's part of the problem. Or it could be like a sweep of the legs or like a knee.
But that'd be a takedown, right? A sweep of the leg.
Yeah, it just kind of depends on how they did it. I mean, they're trying to learn and go off these big pick lists, but it would be a leg strike probably is more. I don't know if I've seen leg strikes. That's more like a karate move. Probably that would apply more to like a knee of somebody.
Okay, so it would normally be either a knee or and in the case of a hand, it would probably be a hand to the face.
Yeah, or anywhere, and it could be a kick too. It's just going to fall under the same.
Councilor Pishner saying no.
Pretty broad.
Hey, you'll get your turn. Anyway, I guess what I want to know is where in the escalation of force does the hand and leg strike come in?
It could be, there's lots of different, we don't really run off of the continuum. But that definitely, if you're saying, you're trying to place them in the custody and they have a weapon or something and they're diving into their pockets, yeah, you can deliver those strikes because you're trying to get them to basically, be out and get the hands out and grab them.
Comply.
Yeah.
Yeah. I think Councilor Pishner actually asked a very good question on how many instances were the subject advancing on the officer and how many times were the officer advancing on the subject. That'd be very useful information.
Okay. I'm making all these notes for the.
I got it. Thanks.
All right, we're Marilee.
I have a curious question, and that has regarding the programming. You talked about researching for trends, trying to pay attention to trends. Is it possible to know what the parameters or know what would be realistically indicative of a trend? Could you program that into the programming, the software you have that would flag a trend for you?
Yeah, that it does have. It's called early identifier warnings, essentially. Basically, it's going to say, like the leg hand strike. Let's say if we put it in there and we're still trying to figure out, if we're going to use it or what numbers. If we put, if we say the officer, we're going to make the limit for 10 leg or hand strikes. Once they hit 10, it shoots an alarm off and sends me a thing. And we look at that, and is there a problem there, or is this an employee who works 1 million hours of overtime, so he just has more exposure than another person? Right. There's deeper into the weeds we go with it if we want to, but yeah, you can do that. It even does it for vehicle pursuits and everything.
Okay, that's what I was curious about, because it sounds like it would be very handy and it would save you folks time. If you're trying to look for something specific, it would already be there for you.
Yeah, that's the good thing of this is that's what we used to do, is spend a lot of time looking, and this thing does the looking for us.
Right. Yes. Otherwise, I appreciate the degree to this report, that this report was done, and especially in comparison to previous, I look forward to being able to compare in the future and seeing how it lines up year to year, being able to use this software. So
So,
thank you. Recognize all the work.
thank you.
Corey.
Thank you. I very much appreciate this report, and I appreciate you digging into the pieces of it and having this as a baseline moving forward. And I don't really have questions, but I have some suggestions.
Okay.
And I want to sort of dig in and encourage us to sort of dig into some of the nuances, particularly around the demographics. One of the things that I would love to see, we're tracking male and female, and I've mentioned this before, if there's a way to track gender nonconforming or folks that maybe are not being interpreted based on male or female in terms of gender, because I think that's an important piece for us to consider. The other thing I'm interested in is how do we connect the demographics to what happens? So it's one thing to say, here's what's happening and here's how many people and here's, Black, white, Latino, Latinx, that sort of thing. But to connect that to to maybe the escalation or the perceived danger or what happens in terms of injuries. And by that, I mean, I'm interested in seeing if are folks of certain demographics more likely to be injured. And I'm not just interested in that in terms of folks who are being arrested, but also our officers. And we don't have any demographics here in terms of who are our officers and who are the people who are answering these calls. But I'm also interested in tying those injuries that are happening for officers to demographics. So are you more likely to be injured if you are a female officer, or are you more likely to be injured in a certain situation? So I think those are ways that we can start to really get into the kind of culture of our organization and start to really lean into if we're going to really take care of both our officers and our community members. Thank you.
Thank you.
Damien.
Hey y'all. So my first question is it possible for Springfield residents to be a part of any section or segment of the crisis intervention training? I'm just curious, I mean, I understand, physical and mental well-being and things like that. I want a little bit more information about what are some of the things that you might do that are going to, support, physical and mental health, but then also potentially humanize certain citizens that in the eyes of some citizens and, law enforcement officials might not be seen as much a human as others. So yeah, those questions.
So the CIT, that's going to be more for the officers to learn how to handle kind of uncomfortable situations they're not used to. It's usually involving the people with mental health. And then the other part, I think, will you tying into the well-being of the officers, like the peer support and that, kind of doing that, how are we incorporating the wellness for the officers? Is that what you're referring to?
Right. I mean, so I guess kind of what I'm getting at is like, what are some of the things that can be done that will get the officers in the community as citizens, where they'll connect with other citizens, which adds some layer of humanity to things, which could potentially lower certain types of run-ins with certain individuals.
Yeah, I definitely. I hate it. COVID made everybody disappear and go under their houses, but it's super important for the police officers to interact with the community and not be, kind of looked at as we don't want to talk to them or we can't approach them. We need all of our officers approachable and to be able to talk to everybody the same. And really the only way, I think the best way to do that is to just do it, to be honest with you. Just start having everybody interact and do these community events again. And, we do things where we try to, invite community members coffee with the cop or, anything we want. I think the chief will back me up on this. We'll go. We're invited, we'll go. And, we'll take feedback and we like being a part of it. There's obviously part of the CIT training is their specialized training on, interacting with, different people or different capacities or everything else like that. And it kind of, takes them a step back and realize that there's all ways of life, just not criminals out there. So that's part of what CIT does as well. And we have people within our organization who are the CIT instructors, and we send them off to bring back the training to help us in-house. And one of them was supposed to go this month, but it's now been moved to April or May, and then she's going to come back and do the training. That answer your question? Thank you, sir.
All right. I've got a couple of questions here. First of all, I thought the call out about the hand leg strikes and looking at the corresponding data was like, that was the first thing that popped out to me as well, right? Just for the frequency of being used, plus the amount of injuries that it's creating for officers and suspects, it was definitely something that stood out for me. Could you help me understand more about how you're measuring effectiveness? So if something's effective, what does that actually mean in the use of force report?
So basically they're putting in there, if they used a taser, they're going to check the box taser, and it's going to ask them, was it effective or not? Yes or no. And then if it's no, then it says, like, did you use something else? And then it says, yes, I used that. Was that effective? Yes. That's how it works.
So, okay, so it's maybe a measurement to sort of gain compliance, if you will, right? So
yes,
if it's effective, they've complied with whatever we're asking them to do at that point.
Correct. It's the effectiveness of the compliance, not the actual.
Okay.
Yes. Sir.
Okay. So when you look at when you get the data sort of coming back and the reports coming back, are people also looking at to see if we actually, I don't know, if the initial order, the initial decision that what we were asking them to comply with, if that on its own was we essentially did the right thing?
Yes, that's part of that approval process. That's the double layered approval is, something we want to look at is, did this really need to happen? Was there something that occurred? Was there a conversation that didn't go well and it kind of created this? Yes, they look at all that. Let me turn my lights back on.
That's time too. Maybe the chief can put, the power bill back in. So and I would assume if you look at an incident sort of end to end, right? Like when we provide sort of coaching and training, we're doing it. Since we're looking at it end to end. If I'm an officer, you're going to come back to me and coach me sort of end to end from the start of the incident all the way through the end of it. Is that accurate?
Well, they're going to review it that way, yes, and the supervisors will provide feedback if they think there's anything wrong with it.
Okay. The other thing that I thought was interesting, like I was a big fan of how transparent we were getting with counting incidents. You were in the report; it's upfront. We're even if it involves sort of one suspect, we're just being really transparent with what actually is happening there. Do we track how many incidents of force are used per suspect? Right, because you give us a total count of how many times we did things, but we don't know if that's 190 people. We know that is just 190 sort of things. And to me, it would be really might be concerning if it was, depending on how many folks were involved.
Yeah, it would be very concerning if the number was 5 for sure, 5 different people. So in this case, there's 190 events on 174 different individuals. So a small handful had more than one thing occur.
Okay. The other piece that really jumped out in the report was the difference between mean and median from an officer perspective. I know that that is sort of maybe phase two. Could you maybe talk a little bit about, are we sort of comparing individual it's not in the report, right? But how many uses of force individual officers have, because it's clear from the data that you do have that some people are using force more than others.
Yeah, that's 100% accurate. We do have that. The chief and I ran that because we were curious. That definitely is a number that we need to follow it, and we will. But you also have to look at it more, and that is, then we can get a whole payroll and say, how many hours did this employee work? A normal employee, 40 hours a week is 2,080 hours in a year. We have some employees working 5,000 hours in a year. So by virtue of that much exposure, one, that's a lot to work, but they're going to have more exposure to things because they're working more. And is it because of that, or is it because there's a problem? And we definitely look at that, and we will be dissecting that going forward. We just, putting our toes in the water with this system, and that's definitely something we want to continue to look at. And if we see something, we'll, try to get to the foundation of what's really behind it, opposed to just the number that first sticks out at us.
So, and that's the piece that I think, like, when we do the report again, I would love to see. And I am open to the PD bringing more statistics to make sense of it, because I think just comparing sort of frequency per officer is not going to tell the entire story. But we also want to sort of take a look at, broader, hours worked, right? How many arrests, just a lot of, there's a lot of potential other detail that's going on. And then I guess the last thing I really wanted to end with is, you started by saying this was the second report. This is actually the third report. And I think that's an important detail, because every time we've done this, the first report was a pie chart. The second report, you guys went through and you dug out everything out of Excel and looked at individual reports to put it together. And the third report, right, was much more data driven, and the data integrity piece was here. And the reason I bring that up is because, right, like, that's how continuous improvement actually happens, right? So when we see version 4 of this report, we're going to have more detail and more learnings about it. And I'm just encouraging you guys to keep leaning in and being as transparent as possible with the data and what you're doing with it and how it's actually changing, because, we're all only asking questions at this point. The last thing I think is really important here, and I'm in favor of this, is the PD having conversations with sort of Eugene and the sheriff's department, and just asking the question, do we track things the same way? I know that it's all over the board about how people track this sort of data. And if from a professional perspective, if people are on the same page, it may make this conversation easier.
Yeah, I appreciate that. And the chief and I want to be 100% transparent. And some people don't like a lot of data. That's why we bought this thing, is to throw the data out there. It's worthless if we're not doing it. There's definitely some bumps involving the hours work thing because of how overtime works and contract stuff, but we can look into that and identify any issues and try to get ahead of that. I do know Eugene Police does use the same software. They're years ahead of us. The program coordinator for it is very helpful, and I owe her a lot of coffee for my questions. And the chief got approval for a crime analyst to be assigned to my office, and that's going to be basically, they're going to be running this IA Pro train and really becoming fluent with it. And it's a very in-depth system that needs somebody to focus on it to do exactly what you're asking. The sheriff's department, I'm not sure what they use or not, but I definitely, because we're always compared to Eugene, I do agree. We do need to be kind of on the same, table of how are we reporting this, because we're constantly being, evaluated. We're separated by a freeway and a river. So I agree that we probably should be trying to collect it the same way, or at least if we're not, explain why we're not doing the way they do.
Yeah. So let me give you my, from a priority perspective, right? I would rather be more transparent than aligned with Eugene. Right. And, when we always tell that story, we always are like, oh, we should track it similar to Eugene. Well, maybe Eugene should track it similar to us.
There you go.
But I also want to kind of come back to the mean and median question. And I want to make this observation. I think it's important that we get to that level of detail. And I think it's really important that we scrub the individual employee names out of it, right? So like if we talk about bringing that forward, I know that you guys as a group will deal with the employee issues. I want to make sure that, you sort of anonymize the data if you put it in the report in the future.
Okay.
Joe.
Thank you, Sean. So it brings up, I just got this thing is haunting me. So you have you run 12-hour shifts. You're talking about officers that may run 5K hours a year, but I'm what really has concerned me from the get-go is the 12-hour shifts. And then we're talking about officer fatigue, and which is a real thing, and everybody knows it in that field, in that profession. I'm curious, has anybody possibly taken a look at uses of force at the, you have a 12-hour shift, but then you have that it's possible to run 5,000 hours by just adding 4 hours, which is 16 hours a day. So that's where you get the double the hours. So, but I'm curious, and if anybody else has been curious, as far as the uses of force on those last, the incidents, the occasion of use of force in that last 4 hours, is that, I know that decision-making process, et cetera, is slowed or hampered somewhat due to exhaustion. And I'm curious as to, are we setting up, or is it being unintentionally set up to where that last 4 hours of overtime is placing the officers in a position in which they may be using more force than in normal hours when they are rested? And I know it's obscure, but I think that IA Pro could probably pull that out. I don't know, but I think it'd be interesting.
Well, I don't think it makes it done 5,000. That was just a number I threw up. But there's guys that work some overtime. That's
Yeah,
sure.
I mean,
I would ever think of.
Yeah, same here. I would. Oh my Lord. So like
I don't know. Lily's and maybe looking at that, but that would have to tie into payroll and sure. I mean, it's 2022. I mean, there's all kinds of things we could probably figure out. It just might take a minute, but
it just seems that if it may be something that could be an identified risk, then it would be definitely worth, not only for the officer's well-being, but also for potentially a heightened use of force during that time, that window. And if I'm wrong, it may be that officers that are working that many hours are too tired to get into stuff that could cause that type of thing, because I've seen it that way also. So, but I think it would be, if it's not too difficult, I think it would be worth our effort to look at that and see if we can pull an anomaly out of just our shifting issues.
Okay, I'll see if it has the capability for that.
All right, Chief.
Yeah, I know you're running low on time. I just wanted to touch on what Councilor Piscineri said. So I know there's people that work overtime, but we have taken very deliberate steps in the last few months to limit the amount of consecutive hours an employee can work to 16 hours. We have what's called a safety release time, where obviously if there's a critical emergency, we can hold people over, but we're not going to allow anybody to work more than 16 consecutive hours. So that's a step we've taken, because I think it is, the data shows that if somebody were lacking sleep, that it's going to impact their decision-making in negative ways. And the last thing we want to do is have an officer make a bad decision, fall asleep, driving a car, hurt somebody, hurt themselves. So we've taken steps to mitigate some of that.
I appreciate that, Chief. We did, the the sheriff's office did lose a deputy with head-on collisions after a long shift. So there's that, but also while working can make a big difference.
Lily.
I was just going to talk a little bit from the data analysis perspective. That is definitely something that can be analyzed. It's like tiredness and fatigue is definitely a subjective aspect of like an officer's shift. But there is a way to look at force incidents and shows of force over the course of like time of day, night versus day, well-lit areas versus, you're in the sunlight versus in a dark alley. And there are ways where I could potentially look and see, like, is a high number of, use of force incidents in the last 25% of an officer's day, or in the first half of the day. It's definitely analyzing the tiredness part and the fatigue part is a little subjective, but finding where events fall in the course of a day is definitely possible.
All right. Thank you.
Go ahead. One last. Okay. Did I hear you say that dispatch is exposed to training?
One of the
I just want to know
recommendations-
what happens at the other end type thing.
Say that again, sorry.
Dispatchers. Are they exposed to the training so they know when they're dispatching what's happening at the other end?
That is part of incorporating them. That's what we want to do,
Okay.
is include them in that, yes.
Okay. I'm curious. I dialed 911 here now. How the heck do I get Springfield dispatched to a Springfield situation?
You call 911 and they'll probably say, what's the address of your emergency?
Yes.
And they will detect it as a Springfield address. They will
Yes.
triage it and get the bare minimum information. And then they will tell you, or you probably don't even know, but they're calling our dispatch and saying, hey, we have a Springfield one for you. Then they transfer you.
So it's transferred to Springfield for actual Springfield dispatch.
Yes.
Okay. I was at something the other night at University of Oregon Police use Junction City for their 911, which I thought was sort of interesting. I don't know why that is, but it must be a reason, but thank you.
All right. Then it looks like that was all the questions. Chief, did you have anything else to add before we let you go?
I just want to really recognize Sergeant Massey again and Lily for all the work they put into this. I think they did a very thorough job. I think we can all agree that there is a lot more that we can do, both training wise for our people here at SPD. And there's also a lot more we can do with this software and the data collection to help kind of guide where we move in the future. And I'm committed to focusing on that moving ahead. I think we're all committed to continuous improvement. I'm impressed with what iPro can do, but I know, like Sergeant Massey said, we're just scratching the surface of what's available. And the more that we put into it, the more we can get out. And so this year, I think, is a good start, but I think we can expect even better things moving forward.
All right. Well, thanks for your time, Chief. It looks like we're going to see you again in the fall for another police update. So we're looking forward to that conversation. Then have a great night. We're going to adjourn and then reconvene in an executive session. So we will see the rest of the council and the staff on the other side. We are adjourned. Thank you.